Professor, you said in your opening statement, I'll come to our domestic situation. You did raise some of the vulnerable communities, and you spoke about Aboriginal and Torres Strait Islander people. I had a briefing on that yesterday in relation to communities across the country. What are you doing specifically in relation to information there?
Well, at the moment we're doing a lot of planning. Dr Lucas Tatoka from the Department of Health is leading a task force on that, and he's engaged James Ward's NACHO and a range of Indigenous organisations. So we are doing a range of planning activities to focus on both. I think we believe that the risks are quite different in metropolitan areas versus rural and remote communities, and probably the biggest single concern is trying to keep the disease out of communities, particularly non-metropolitan communities. I think in a metropolitan area the health system would probably be able to cope as it would for the general community, but in isolated communities this infection could have pretty devastating consequences. So we are likely to put in a range of much more advanced protective measures than we would for other parts of the community, particularly focusing on the FIFO workers who come in and out. They present a particular risk, and so we're planning a range of different approaches to staffing and screening of people coming into community so that we can try and prevent it coming in. So at the moment, again, the risk is pretty low. Most of the cases we're seeing are in metropolitan capital cities, but that work is ongoing this week, and we will be presented, governments collectively will be presented with a management plan in the next fortnight, focusing on Aboriginal and Torres Strait Islander communities.
The Prime Minister made some comments yesterday in relation to the concern about the vulnerability in communities. Shouldn't we also be cautious about the language that we use so as not to scare people even more about that? And I'm very concerned about it because we have over 100 Aboriginal languages in the Northern Territory, and already there is a great deal of fear amongst those Aboriginal communities, especially when words that have been used by the Prime Minister in particular about that fear.
Sure. So I think we are collectively trying to reassure the community, but also be transparent with the community about the preparation work that we're doing. So I think you're right that we have to be very careful about our language, and I think the Prime Minister is merely referring to the planning work that we all have to collectively do. The same could be said for aged care. I think there could be a lot of fear in the aged care sector if we don't discuss the potential risk sensitively. But on the other hand, we have to be transparent with these communities where they are at risk. So I take your point that we need to be very careful about our language, and we have spent a lot of mental anguish in the last week working out what is the balance between reassuring the community, because the community should be reassured. We have a good health system, we are very strong, but we also feel that we have to bring the community with us when the clinical situation changes.
So in your preparation for our remote and regional Australian communities now, what plans are being undertaken in terms of isolation and quarantining, especially in our remote regions?
Yeah. So they're being worked through at the moment, Senator. They're not finalised, but they're actively. There's a task force working on this over the coming week, and we'd certainly. Most of the plans, our national COVID-19 pandemic plan is a public document, and I'm sure we'd be happy to share with you some of our Aboriginal and Torres Strait Islander health plan for COVID-19 when it's developed. We've taken the view that these plans should be transparent and widely accessible.
You also said in your introduction that in terms of face masks and all sorts of other equipment, how are they going to be rolled out in these communities?
Again, that will be a feature of the plan for those communities. At the moment, we are focusing on identifying all of the personal protective equipment that the nation has in its states and territories, Commonwealth stockpile, hospitals, various, and working out what we might need in various scenarios. And Minister for Health and the Prime Minister have instructed us to make every effort to increase the national supply so that we are well prepared, and there's active progress in that space at the moment. But ultimately, whatever the Commonwealth procures, we don't deliver much in the way of health services. We will be spreading out to where health services are delivered, and clearly Aboriginal and Torres Strait Islander communities, aged care facilities, primary care, hospitals, all of those places will be important in, and that's in the distribution. But at the moment, again, there's no demonstrated need, but we will be, that's very much part of the plan.